understanding, rehabilitation, and safety for staff and patients. Rehab gyms consist of a rehabilitation director who's in charge of monitoring the care of the patients who are receiving rehab, physical therapists and assistants who provide physical therapy treatments, occupational therapists and assistants provide occupational therapy treatments, speech language pathologists provide speech language treatments, office manager deals with the billing, paperwork, faxing, and the rehab techs. If your gym has a rehab tech, the rehab tech's responsibility is to maintain the gym, tidiness, and keep patients on a schedule to and from the gym to make sure all the rehab needs are met. Physical therapy works on transfer training, activating the patient from one service to another. Gait training, which is walking, where we analyze the patient's gait pattern. Balance training, fall assessments. At home, we either take a therapist, we take the patient and a family member, and we make modifications on how to make the home safer. Lower extremity strengthening, lower body splinting, hip and knee rehab. A few things we do in physical therapy. Occupational therapy, work on self-care skills, upper extremity rehabilitation, homemaking assessment and training, edema management, driving risk assessments, which only can be performed at Dove West, visual perception retraining. OT works with any ADL that you have that you need to do to go home. Cooking, cleaning, laundry, whatever it might be. OT when you go home so you can stay at home. And if you can't perform it, then we have to figure out ways to make adaptations so you can. Speech therapy, swallow, cognition, memory, attention, problem solving, safety, medications, call light. A lot of times patients will have some short-term memory loss after surgery because of the safety and the medications all come in place. We have to make sure the patient can go home safe, make good judgment calls, and be able to take their medications. Speech also works on communication. It's very important that a patient can communicate. So if a patient does have a communication device in their room, maybe it's a whiteboard or iPad or whatever it happens to be, please use the communication board with the patient. The speech also works with voice clarity and volume. Patient safety. Some patients will have certain braces. The pictures here are a neck, cervical, and check their care plan for proper wearing schedule. Normally, anytime a patient is up, the brace has to be on. Some patients can never take the brace off. The brace are for shoulder and hand. This is for knee and foot. And a lot of times the patient that has a knee or foot brace, they may have a weight-bearing restriction. Please make sure you check their care plan. Take-home message. They do not guess on how to put it on. Make sure the brace is on properly, make sure it's on right, or it could cause harm to the patient. Please ask nurse or therapy department. What do I do if a resident falls while I'm working with them, or I come upon a resident who has fallen? This is our policy in the company. Activate the emergency light. You stay with the resident till help arrives. The RN must assess prior to moving a resident. You always use a Hoyer lift or total mechanical lift, and 2 people get the resident up. Even if the resident may be able to stand up by themselves, you have to use a mechanical lift, because you don't know what harm might have come to the resident by falling, and by letting them get up by themselves, you could harm them, and you could also harm yourself. The difference of restorative therapy versus skilled therapy. Restorative therapy is managed by nursing. Skilled therapy is managed by certified therapists. Restorative therapy is completed by restorative staff and CNAs. Skilled therapy is completed by licensed therapists. Restorative plan is established by therapist or the restorative nurse. Skilled therapy seen by the therapist. Restorative therapy is utilized to maintain function. Skilled therapy is utilized to increase function. Restorative therapy is included in a room rate, no extra charge. Skilled therapy is funded by Medicare, insurance, or private pay, and there is a charged to the patient. Restorative therapy plans are reviewed quarterly, and skilled therapy they're reviewed weekly. The one thing that is the same between both restorative and skilled therapy is if a patient has pain during the treatment, we need to make sure we let the nurse know or your supervisor so the patient can be pain-free or as close as possible. Restorative therapy, if you're performing a program and you notice that a patient maybe is showing a decline or improvement, please let the RN know so that they can send a screen to therapy. Restorative plans cannot be changed by therapy unless they're in caseload. So the restorative nurse has to change anybody that's been on a long-term restorative plan. And make sure if a patient refuses, whether you're a CNA doing the plan or you are a restorative CNA, make sure you tell your restorative nurse or your supervisor that the patient is not performing properly so we can maybe therapy and screen, or we can make sure we get our documentation. If you see a patient that's discharging from our facility and they have any equipment with red on it, red paint, or property of Dove Healthcare, please do not let them leave with that on. That is our equipment that we allow them to loan, and we need to get that back so we can loan it out to another patient. What should you do if someone asks you for a drink? You always stop and check the care plan. How do I check someone's diet? You check the care plan, breakfast roster, snack cart roster. There's posted lists by the coffee machine and most of the beverage machines. There's mealtime tickets, and there's happy hour roster. It's very important that you always check the care. Wrong fluid or wrong diet, you could cause someone a great deal of harm and possibly death. Care plans, this is how it's listed on the care plan. You can see the diet meal assist, tells you their diet, tells you what liquid they need, and any help they may need. There's resource manuals that you can access to tell a person's diet. There are the dining rooms. Dyes, textures, and liquids. Thin liquids, included but not limited to coffee, tea, milk, hot Coke, chocolate, fruit, lemonade, soda, just to list a few. You guys can read the rest. Foods with thin liquids. This is tricky because a lot of people don't think food is considered a thin liquid. Watermelon, pineapple, grapes, coleslaw. Nectar thick liquids or slightly thick. In between liquids. The one thing I want to mention, if it is ice cream, the ice cream still has to be frozen. If it melts in a room, then it's considered thin. So make sure it's still cold and frozen when the resident's eating it or you're assisting them. And you can see the items there that are listed for slightly thick. Nectar thick liquids, easily pourable, comparable to thicker ice cream or soups. You can see in the pictures there are packets that have nectar on them that are already, all you have to do is you pour the powder in and add the amount of liquid it says to add, and it will thicken as you stir it, so you know you get the right amount. Nectar thick kind of drips off the spoon. Honey thick liquids, less pourable, drizzle from a cup or bowl, often clumps off a spoon, and once again, of course, they also have packets that'll say honey thick if you had 8 ounces of fluid or 4 ounce fluid, whatever it happens to be. So all you have to do is follow the directions, you'll be able to make honey thick liquids. Pudding thick liquids should only be thick enough to be eaten with a spoon. Do not pour out of a cup. Consistently close to actual pudding or yogurt. And it's not used often, but it does get used with soda for some of their more complicated patients in the vent unit, and sometimes for pleasure feeding. So pudding thick, you don't see it very often, but this is consistency. Spoon and fork test for liquids. You can see by the pictures, nectar, honey, and pudding. Just always remember, if you're not sure that you're mixing it properly or know how to mix it, please make sure that you ask somebody. Do not guess on this. It can cause someone a great deal of harm. Do not guess. Always make sure you're correct with the liquid you're giving the patient. General textures. All foods allowed. No restrictions. They can pretty much have whatever they want if they're on a general texture diet. Mechanical soft. Food that are moist in nature, cut in bite sizes. Dysphagia 2, fork mashable. Foods that are soft and moist, can be gummed easily, ground or very soft meats, that's for fork mashable. And some are slurried, where you add extra gravy or extra syrup or extra butter to make them more of a, I guess more of a kind of pudding consistency, or fork mashable. Puree, food require no chewing. They're all pudding-like. It's considered puree. You need, so you know the patient gets the right diet. See right there, it says dysphagia 3, that's the type of diet they're on. That's their tray assist. They have supervision, cut up their food in small pieces. That's the directions for the patient. If you're helping a patient eat, you have their directions. There's notes on there about the butter, extra gravy. And also has on there the beverages too. Employee safety. If you're able to cut and paste this and take it to your browser, there is a video on body mechanics that you should watch. So please try to do that. If you're injured at work, it is your responsibility to report it within 24 hours. So the best case scenario is if you're injured at work, please report it right away. That's the best for you, the best for us. We can get you to a doctor. If you need a doctor, we can get your workman's comp claim started, and we can get you treated and get you better and back to work as soon as possible. So no matter how minor the injury is, please report it. If you're injured at work, what normally happens is you'll go see the doctor and you get sent back with what's called a modified duty capacity or modified duty restrictions, and it will say you can only lift 10 pounds or maybe only stand for an hour. What will happen at that point is you will go back to work in your normal job description, doing whatever you normally do, normal time, but underneath the modified duty restriction that's set in place for you. And you'll work in this until the doctor clears you that you can come back to work. If you're injured outside of work, you cannot come back to work until you can meet everything that's required of you with your job descriptions. Cannot come back to work until you can meet everything within your job description. Thank you.